Hi, I'm Dr. Joel Cherdak. Today I'm going to discuss stem cell therapy for the ankle. So the ankle has a lot of different bones and a lot of ligaments and tendons involved in it. So there are many areas where degenerative arthritis can occur, ligament damage can occur, and tendon tears can occur. So first off, I'll talk about degenerative arthritis. So you have many bones in the ankle. It's not like a knee joint where you just have two bones or a hip joint where you just have a ball and socket. There are actually a number of bones and joints in the ankle. So you can think of the top bone, which is called the talus, and then your heel bone, which is the calcaneus, and then you have your bones in front of that, and then you have your bones that are called metatarsals that are before your toes, and then you have your toes. In any of those joints, you can develop degenerative arthritis. And because the ankle moves in so many different ways, and because we spend so much time on our feet, particularly people who have been involved in athletics their whole life, those joints can become misaligned and become degenerative with arthritis fairly early in life. So we're able to treat that degenerative arthritis with our stem cell therapy with the process that I've described in previous videos. Another function of the ankle is that stability is controlled by the ligaments. So you have a lot of tiny ligaments in the ankle, and for those of you who've played a lot of sports, particularly soccer or baseball or basketball, you know how easy it is to chronically twist your ankle. And over time, twisting your ankle can cause those ligaments to become loose and oftentimes create a lot of micro tears in that ankle, and people can have chronic ankle instability, which because of the ligament laxity can also lead to degenerative arthritis, but we can also treat that ligament damage as well. And we do that by getting an MRI on the ankle, looking for where those tears are, confirming them with our ultrasound, and then treating them with our stem cell therapy, and we get great results with that as well. A third area where people get damage in the ankle commonly is the Achilles tendon, and everybody's heard of Achilles tendon tears. They're fairly common. So as long as the Achilles tendon isn't ruptured completely and severed, if there are tears in the Achilles tendon, using stem cell therapy is one of the only things, in fact, the only thing that you can do that will actually regenerate the tissue. The only other option is surgery, where you're just kind of sewing the tendon back together again. And that, of course, creates a lot of scar tissue and a lot of decrease in mobility. So with stem cell therapy, what you're able to do is just have your body regrow the damaged tissue, because the stem cells signal to the damaged tissue in the area to start regrowing and filling in the gap. And we want you, unlike surgery, we want you moving right away so that the tissue starts to organize in the proper manner and you wind up with the same amount of range of motion. You're not getting scar tissue and you're not losing mobility. Oftentimes when we see patients present with ankle issues, it's a combination of things. It's degenerative arthritis along with ligament damage, and sometimes some tendon tear in the Achilles tendon as well. If you're suffering with chronic long-term ankle pain, if you have arthritis in your ankle, or if you've had a recent injury that's just not healing very quickly, please click on the link at the bottom of the description of this video and it'll take you to our homepage. You can fill out a free patient consultation request, or you can call our clinic directly and our patient coordinators will get right back to you and answer any questions that you have. We look forward to hearing from you.